another terminology what you have to know is femoral sheath. Actually it is a facial covering of your femoral artery and femoral vein. Actually you already know that in the fetal life your thigh will be in flexed position. So immediately after delivery the extension of thigh leads to prolongation of your abdominal fascia down covering your femoral vessels, that is called as femoral sheath. So this will be the femoral sheath. Actually it will be covering only the proximal part of your femoral artery and your femoral vein. So it is having anterior wall and posterior wall. Anterior wall is formed by the downward extension of fascia in the anterior abdominal wall, that is fascia transversalis. So like that you will be having posterior wall that is formed by, already I told, iliacus muscle. The fascia covering your iliacus muscle is the fascia iliaca. So that fascia iliaca forms your posterior wall. Your anterior wall is formed by your fascia transversalis. So repeatedly you have to see these terms, so then only you will be familiar with that. So that is your femoral sheath. If you see the contents of femoral sheath, so you have your femoral vein in that, you have your femoral artery, but the femoral nerve is outside. That is the important point. Your femoral sheath is covering only the femoral artery and vein, not your femoral nerve. Femoral nerve is outside. Actually you will be having a septum separating your femoral artery and femoral vein here. Like that another septum separating your femoral vein and medial most part. Actually that medial most compartment of your femoral sheath is called as femoral canal. So into that only I am putting my finger. So this is called as femoral canal. So the medial compartment of femoral sheath is femoral canal. Next intermediate compartment is femoral vein. Your lateral compartment is the femoral artery along with femoral branch of genitofemoral nerve. So this is lateral compartment, this is intermediate compartment, this is your medial compartment called as femoral canal. So this femoral canal is important. In the femoral canal we have deep inguinal ligament that is called as Clawfoot lymph node that drains the glans penis in male, clitoris in female. So that is important for your MCQ. So now this is your femoral canal. So see my finger now, this is your abdomen, isn't it? So this abdominal layer only covers your femoral canal and the abdominal aspect. So what you are seeing here, this is called as femoral septum. So later on you are going to read in abdomen the detail about the layers. So here you will be having extraperitoneal fat that will be forming your femoral septum. So if you take that femoral canal, it is opening into the abdomen through a opening that is called as femoral ring. That femoral ring is anteriorly bounded by your inguinal ligament. Posteriorly it is bounded by another ligament called as pectineal ligament. Medially it is formed by a small part of your inguinal ligament called as lacunar ligament. Laterally it is formed by our femoral vein. So laterally femoral vein, medially lacunar ligament, anteriorly inguinal ligament, posteriorly pectineal ligament. So these are the boundaries of the opening of femoral canal into the abdomen. So that opening is called as femoral ring. So that femoral ring is covered by extraperitoneal fat of your anterior abdominal wall, that only called as your femoral septum. So this is femoral septum. So femoral sheath is important short notes for you. So now this is your femoral canal. Okay, so that is your femoral sheath. So it is formed by anterior wall and posterior wall. Anterior wall is formed by your fascia transversalis. Posterior wall is formed by fascia iliaca. It is having three compartments. Lateral compartment contains your femoral artery. Intermediate compartment contains your femoral vein. Your medial compartment is called as your lymphatic compartment, it is called as femoral canal. So this femoral canal opens into the abdomen through femoral ring. The femoral ring is bounded by anteriorly inguinal ligament, posteriorly pectineal ligament, medially lacunar ligament, laterally femoral vein. So that femoral ring is covered by your extraperitoneal pad of fat, that is called as femoral septum. Now important point, as this femoral canal is considered as the weak point, so any abdominal content may protrude through this, called as our femoral hernia. Femoral hernia may takes place through this femoral canal. Okay, so the abdominal content from the abdomen may protrude through this, like this. It may come through the femoral canal, that is called as femoral hernia. Okay, so that is the importance of your femoral canal. So the clinical importance and how the lacunar ligament is important are demonstrated in the another video. Actually, while doing the reduction of femoral hernia, sometimes you may cut your medial boundary, that is your lacunar ligament. That is clinically important. What is that important structure related to it is your abnormal obturator artery. Abnormal obturator artery is related to that your lacunar ligament. While cutting that lacunar ligament, you should be careful of your abnormal obturator artery. So in detail you can read while doing your abdomen. Okay, so that is your femoral sheath. So in this video I have shown the boundaries and contents of your femoral triangle. So this will be useful for your discussion point of view as well as for spot test. Okay, thank you for watching.